Hey everyone, today we're going to delve a little bit deeper into Chapter 1, specifically looking at 1.4. Now, I've split this into two sections, but it is still very vocabulary heavy, and please take precaution and begin studying now for a lot of these different words. The reason it's so vocab heavy is because this covers the language of anatomy. Special terminology is used to prevent misunderstanding, and there is terminology for the position of different organs, the direction or how are they related to one another, the regions they're located in, and even specific structures on organs themselves. So this is a big, wide range of terminology that we're going to be learning and understanding this year. Before we even get started on it, we have to clarify something, and that's called anatomical position. This is the standard body position we use to avoid confusion, or it's a reference point. We know that we can twist our bodies in all different ways, and so we have to have a localized figure or body position to study and look at. All this terminology that we're going to be talking about refers to this anatomical position. That is standing erect or standing tall, feet parallel, arms hanging at the sides with palms facing forward, and the thumbs are pointing away from the body. And I guarantee you this is going to be a question on your guys' test, so I'm just going to go ahead and start it. So here is an example of anatomical position. You see this figure standing upright. His feet are parallel. His palms are facing forward. Notice his thumbs are towards the outside, and he's facing forward, with his head facing forward as well. Now that we've kind of covered anatomical position, let's talk about directional terms. What are they? Well, directional terms explain the location of one body structure in relation to another. For example, where's the heart located compared to the lungs? Another example that your book gives is instead of saying the ears are located on each side of the head to the right and left of the nose, we can use a directional term for lateral. We can instead say very precisely the ears are lateral to the nose. So what I've done with a lot of these directional terms is try to pair them up where they're opposites of each other. So the first two we have are superior and inferior. Superior means towards the head or above. If you think about your superiors, your bosses at work, they're above you. Inferior, sometimes you might hear the phrase, oh, you think I'm inferior to you. That means below. So this means away from the head or towards the lower part of the body. Here we have an illustration from your book, and a good example here is your forehead is superior or above your nose. For inferior, we have an example, your navel, which is your belly button, is below your sternum or your breastbone. Anterior and posterior are the next two. Anterior means the front of the body or in front of. Typically, if you're looking towards someone's face and they're facing you, you're seeing their anterior view. Posterior means towards the back side of the body, or if they turn around and you're looking at them from behind, that is a posterior view. An example from the book is your breastbone, which is your sternum, is in front of your spine. For posterior, it says the heart is posterior to your sternum, and that makes sense. Your heart should be behind that breastbone for protection. These three terms, medial, lateral, and intermediate, also are pretty well connected. Medial means towards the midline of the body or on the inner side of. So for example, if I'm drawing a person, which I'm very bad at it, and you split them right down the middle, this is more your medial zone, towards the midline. Lateral is going to be towards the outer side. So lateral is going to be towards the right and left, the sides of. And then intermediate is it's not quite the middle, it's not quite the outside, but there's more of an in-between. So intermediate. I love that your book gives these illustrations because we do get to see examples here. So, for example, your heart is in the middle or median up to your arms. Vice versa, your arms are going to be towards the outside or lateral to your chest. And then I love this example of intermediate. Your collarbone is actually in between your breastbone and your shoulder. So your breastbone's right here in the middle. We got our shoulder over here. And right here would be where your collarbone is. Now, these two terms are honestly the most confused terms for everybody, and that's because proximal and distal sounds like proximal, like proximity, you're close, and distal means you're far away. And yes, those words do come into play, but I don't mean proximal or close to an organ or far from an organ. I'm talking about point of attachment of a limb to a body trunk. What do I mean by that exactly? So I'm going to go back to this handy dandy picture. The trunk of our body is basically the bulk of our body. This is going to be our trunk. Everything else are limbs. So your arms and legs are limbs, and they have to attach to this trunk somewhere. For example, your arm attaches up in your shoulder, and your legs attach down here in your groin or pelvic region. And what proximal means it's closer to this area of attachment. So, for example, your thigh down here is proximal than your knee. So, it's closer to up here to attaching than your knee is. Distal, on the other hand, means farther away. So, your ankle is distal to your knee. It means your ankle attaches further down than your knee does. So, this is why people often have confusion with these terms, because they forget it usually has to do with a limb. Here's the ones that your book uses. Your elbow is proximal to your wrist. So your elbow is closer to your shoulder or point of attachment than your wrist is. The last two are usually pretty easy for people, and those are superficial and deep. Most people have heard like a superficial wound. That means it's not very deep. It's towards the surface. An example your book uses is the skin is superficial to the skeleton or towards the surface. Deep means more internal, so your lungs are deep to the rib cage. Makes sense. They need to be towards the middle of your body more because they need more of that protection. So here are some examples that we have. If you want to, please try to pause this video, see if you can think of the answers that should go in these blanks, and then let's unpause it and see how you do. Now that you've paused it, let's kind of see how you did. Here we have the wrist and hand. One thing I want you to know is that these can have multiple answers. For example, both of these are on a limb, so we can use proximal and distal if we want to. Your wrist is actually proximal to your hand, or your wrist is closer to your shoulder than your hand is. Another word you could think of is, since we're standing in anatomical position, technically your wrist is above your hand. So we can say the wrist is superior to the hand. Down here, the breastbone is blank to the spine. Remember, this is your sternum. So your sternum is actually in front of, it's part of the front of your body. So we're going to say anterior to the spine. The next one is your brain. This is located in your skull, and your spinal cord is located in your back. So we can actually say the brain is superior or above the spinal cord. And the last one, we have the thumb and fingers. Again, we can use proximal and distal here. So we can even say the thumb is proximal to the fingers. Or if we're standing in anatomical position, we know those thumbs are towards the outside or the lateral. So we can say the thumb is lateral to the fingers. With that being said, all of this is awesome, but we still have regional terms that we have to deal with, and these are visible landmarks on the surface of the body. We have both anterior body landmarks and posterior. Anterior, these are going to be the ones in the front of the body, and posterior are going to be the ones in the back. You're going to note there's way more anterior body positions than there are posterior. and that actually is very beneficial. Here is your anterior, and I know it seems like a lot. You guys can go ahead and label the person in your guys' notes. A couple words that you will not probably use that's on here is cephalic. You also don't have to label manus, which is hand, or pedal, that is foot. And of course, you don't have to write upper limb if you would not like to. Here, I'm going to go ahead and skip to the next page to kind of give you a written description of where these are located. If you need to fill in your picture, you guys can pause and then continue and catch up with us. So for anterior regional terms, we have the following. Abdominal just has to do with your trunk. So when we look at our abdominal region, it's going to be here in purple. It's going to be more towards our abs. Abdominal, our abs. Next, we have our acromial. This is a point in our shoulder, and it's actually named after the part on your scapula and clavicle where they're going to join and make different joints. So here we have labeled here our acromial, followed by our deltoid muscle, which is actually right here. It's a big muscular part where they usually put different shots or injections. Oops. Then we have our antebrachial, which is our lower forearm, and our antecubital, which is going to be located in our elbow. Our antecubital is actually named after a blood vessel that goes through there. And then axillary is our armpit, and brachial is our arm. So if I look back here we have our antebrachial, that's our lower forearm. The cubital is going to be your armpit hole. And then, of course, our brachial is our upper arm. Your buccal area is your cheek. Carpal is your wrist. So I always think of like carpal tunnel. Cervical is your neck region, and that's actually named after your cervical vertebrae that are located up there, or your cervical spinal cord. So a lot of people confuse this and put this down near their groin region because they hear the word cervix, but cervical means neck. Next, we have our coxal bone, which is in our hip. And then we have our cruel. This is actually one of the funnest things I remember. This is around your shin. And I always remember this by saying it's cruel to kick things and people in their shins. Digitals are your fingers and toes. Femoral is your thigh. I always think of femur. Fibular is the lateral part of your leg. So remember, this is going to be the outside. So here is fibular. It's going to be right here on the outside. It's really close to your fibula bone, which is also a lateral bone as well. Frontal is your forehead, and then inguinal is where your thigh meets your body or where your groin is located. Couple other anterior regional terms are going to be your mental. This is one that's most often confused. This is actually your chin. A lot of people want to say your forehead, but that's frontal. We have nasal, oral, and orbital. These are usually the three most common ones people recognize. Nasal being nose, oral being mouth, and then orbital being eye. We have our patellar, which is named after the patella, which is your kneecap. Your pectoral is around or on your chest. Think of your pecs. Pelvic, this is area near your pelvis. Pubic is going to be your genital areas. The last couple we have sternal. This is named after your sternum, and this is your breastbone area. Tarsal is your ankle, so carpal, tarsal. And then thoracic, this is going to be between our neck and our abdomen, mostly our chest region. And then last but not least, in the very middle of our anterior regional part of our body, we have our umbilical cord, navel, or most people know it commonly as the belly button. Here is our posterior view. So just like the anterior, you guys can go ahead and pause this video and fill this in on your notes. One thing I love is that there are duplicates, so hopefully it'll help you study, and there's not near as many terms. Couple terms you don't have to label are the upper limb, your manus, lower limb, and pedal, and then even your back and cephalic. But all those other parts are pretty good things to label. So here are our terms. Calcaneal, this is the heel of your foot. And I always remember you usually get a lot of calluses on the heel of your feet. Cephalic just means head. Femoral means thigh based off your femur. Your gluteal, most people have heard of your gluteus maximus, but you also have a gluteus medius, and this is going to be located in your buttock region. Lumbar is an area some people may have heard of if they've heard their parents talk about lumbar or lower back pain. This is going to be between your ribs and your hip. Our occipital is actually the posterior or bottom side, back side of your head or base of your skull. This is actually named after your occipital bone in your occipital lobe, which is in your brain. This houses the vision resource center. So if you get hit there hard enough, you can get blurred vision. The olecranal is going to be the posterior or backside of your elbow. Popliteal, this is your posterior kneecap area, so back behind your knee. I always think when you usually stretch this, your knee goes pop. Sacral, this is named after your sacrum, which is part of your spine. It's at the very base above your coccyx or your tailbone. Scapular is named after scapula, which is your shoulder blade. Sural, this is going to be the opposite of crural, so it's not your shin. Sural is your calf. Vertebral is going to be where your spinal cord is located, and then plantar, this is going to be the sole or the balls of the feet, where you plant yourself when you jump. And that's the end of today's lesson. If you have any questions, please do not hesitate to ask or come in for help, and I hope you guys have a great day.